You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Curtis Mack. Dr. Curtis Mack is a board-certified radiation oncologist at Arizona Oncology, an affiliate of the U.S. Oncology Network. Dr. Mack, who lives and works in Tucson, Arizona, is active on the board of Handy Dogs, a local nonprofit organization dedicated to training service and therapy dogs for seniors and those with disabilities. He understands both sides of the stethoscope because he is a cancer doctor and a cancer survivor himself. Welcome, Dr. Mack.
Thank you for having me.
Well, we're excited to have you on the podcast today. So we understand that you have a personal experience on how dogs have helped you. Would you please share your story?
Absolutely. I was diagnosed with leukemia in the summer of 2013, which was a complete surprise to me when I had abnormal blood counts and went from working out and being in the office one day to being admitted to the hospital the next day and off work for exactly 1 year.
Oh, I'm sorry.
No, well, it's okay. It happens. So instantly, your life changes. And I had to stay in the hospital for 23 days at that point. But then, after induction chemotherapy, I was allowed to go home, where I had 3 dogs. During the time that I was in the hospital, I could look out the window and see them a couple times. And I did sneak down to the lobby a couple times as well. But when I got out and I'm at home and I'm trying to recover from the chemotherapy, it was helpful to have them around and to have a task. I mean, I went from full-time, crazy busy to all of a sudden now I'm just sitting at home recovering from chemotherapy, and having the dogs around who need you and don't really expect, or don't respect the fact that you've had chemotherapy and you're tired. They're just like, we have our needs and we know you usually take care of them. So right. Get off your butt and let's go.
Yeah. So first, what type of dogs do you have?
I have Weimaraners, all Weimaraners.
Okay.
One that I purchased, and then the other 2 were rescue.
Oh, great.
So, and they're athletic, active dogs. Now, the one at this point was getting up there in years, so he didn't need to go running, but the other 2 needed a lot of stuff. They were just 11 and 10 years old.
Okay, yeah, and they're very active dogs.
And very active dogs. I used to run them 4 or 5 times a week in addition to park trips. So it was helpful to have me get out and do that. And it was more so, that part was actually relatively easier than after I had to go to Seattle for my transplant, which was part of the program. And that required more chemotherapy and more radiation. And that made me sick as a dog. And that really put me, out on a bed, not able to eat or drink, and everything was through the IV. So when I went home to a townhouse in Seattle, I couldn't even carry a gallon of milk. At that point, I had a lot of help. It took a village, but they still looked at me for, a lot of their, stuff, and much of it I couldn't do, but yes, I could get up and get out and take them out for a potty break. And I made me get dressed and go out, put on warm clothing because it was Seattle in November, and December and January, to get out and go for a walk. So, and I got a little bit of grief from my treating physicians because, you have to be careful around dogs, they say, for potential infection risk. And frankly, it's hard to keep the dogs away from me. 1.
Yeah,
2,
sure.
I didn't want them away from me.
Yeah.
I was freezing cold. I was so skinny and hairless, and I'm like, I need the dogs for warmth. So I didn't abide by that too much, although we washed them frequently. But there was an article that came out just about a year and a half ago that talked about patients who spent a lot of time, including patients who had transplants, and a lot of time with their animals versus those who didn't. And there was no difference in the rate of infection. Mm-hmm. And the conclusion was that the emotional support and physical help that the dogs give you is certainly more worthwhile and beneficial than trying to exclude your animals from your life.
Yeah,
so,
by all means. Mm-hmm.
So, and I know that's important to me, and I know it's important to my patients.
And I have volunteered for the Chicago Rehab Institute, and they have a program where they'll bring dogs in, whether you're a volunteer or you're a volunteer with your dog, and you work with different patients, whether they're burn victims or stroke patients. And it's just unbelievable how the patient's face lights up when the dogs walk in.
It's crazy the interactions you get when you bring animals to the hospital, and we train with handy dogs on my off time position there on the board. We train pet therapy teams to go into facilities like nursing homes, hospitals, and even schools during exam times, and it makes a huge difference. People really do light up.
And I'd love to have you back on the podcast to talk about that organization and how people could volunteer with their pets.
We have so many opportunities. I talk to my patients now because some of the patients are older. They've lost an animal, and I feel they need that stimulation to really re-engage. And, one of the things people can do is foster. So it's not a long-term commitment, but at least you get a dog back in your life and something to care for and something to make you leave the house.
And do you think your dogs knew that you were sick? Because I've had different surgeries throughout my life, and my dogs have always known. Like when I was younger and my mom would come up and, help with whatever surgery it was, and I'd be in bed and our golden retriever would come and just rest her head on my stomach. Just very quiet and almost like a little nurse. So when you were going through this process, do you think your dogs realized that you were not 100%?
Oh, yeah. They clearly weren't expecting me for a run or anything too crazy. They just, it was more about coming to get attention, jumping up on the sofa, jumping under the blanket, running out to do a quick potty break until I got stronger and I could manage to take them on longer walks, which again, helps to get you out, especially when you're on restriction and you're neutropenic and you're immunocompromised and you're not allowed to go to big gatherings and you're not allowed to go to the gym even.
Yeah. Well, and they do, and dogs really do, they are your best friends. I mean, because I'm sure family members might say, come on, it's time to get up and I don't feel well, I don't want to. But a dog's looking at you and you have a responsibility. That's
right. In addition to, getting out to take your dog out, it also increases your social interaction a lot and can, help some of that void when you're ill and out of your normal environment. They did a study and they took elderly folks and set them on a park bench and watched and observed. And then they sent an elderly patient on a park bench with a dog on a leash. And the amount of interaction that happened with passersby was vastly different. So it's almost the dog, is a bridge to communication for people to interact with. It gives them a common thing to discuss and talk about. And that, really increases people's mental attitude and improves it.
Well, and I think that's so important when you're trying to heal from an illness.
Right.
To get some type of normalcy back.
That's correct. You need to have a good attitude. I tell patients that food and water don't kill cancer, but they make you strong enough to endure the treatment, and that's important. If you can't get through the treatment, you can't get treatment for your cancer.
Right, exactly. Well, how are you doing now? Are you cured?
Well, theoretically, my oncologist is a bit pessimistic. Goes, well, there's always a chance you could fail. But I just scheduled my 5-year follow-up next August.
Oh, congratulations.
So I am looking forward to that. So,
well, thank you for your time and your story.
No problem at all.
It's very powerful. I'd love to have you back to talk about all of your volunteering with therapy dogs.
No, anytime.
So this is kind of a funny story. I volunteered with the Golden that I was telling you about at a nursing home. And she went through all of the training through the Humane Society. And we got to the first nursing home. And you know how seniors will put tennis balls at the bottom of their walkers?
Oh, I know where you're
She
going.
attacked them. So she was asked not to come back.
That is one of the things we do train for at Handy Dogs, because that is not the first time I've heard that story.
Yeah. Oh, it was hilarious.
That's it. Yeah, that is good. We're now, the program is getting more interesting because we're doing rescue to service. We're going straight to the Humane Society and pulling dogs out.
Oh,
how
like wonderful.
For training. And we're just starting to look at working with a prison for inmates to do some of the training, so that they can get some sort of normalcy in their life. So it's some pretty exciting stuff.
Well, Dr. Mack, thank you so much for being on the podcast and letting everyone know your very touching story and how dogs helped you recover. And I just wanted to find out, one, if you'll come back on the podcast. And
anytime.
Okay, perfect. And two, is there anything else that you would like to let our listeners know?
Absolutely. If you don't have a dog and you like to walk or you need to walk, you've got time in your life for a dog. Dogs are good for people and people are good for dogs. So there's some dog out there in a shelter somewhere that will make your life better. And go out and get it and get outside.
Oh, that's a great comment. So thank you very much. And I hope you have a happy holiday.
Thank you very much. You too.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.